Hi, Dr. Mike Quast here. Last time you were here, you were adjusted, and today we're going to adjust you again and show you some more information. If you have felt sore at all, that's totally fine and okay. Don't panic. It's kind of like when you go to the gym for the first time and you feel sore. We're not expecting to see a lot of muscle change in these first couple visits, any more than if you went to the gym 2 or 3 times and then wondered where all your big muscles were. Probably not going to see those changes. But we're trying to get a feel for how you're going to react, because next time one of our staff is going to go through and we're going to estimate what we think it's going to take, how many visits you're going to need, what your costs are going to be, how to fit that into your budget so that we can have a good treatment plan as far as what we're doing so we can get the best results for you. A couple links to show you if you want to take a look at this paper here. It talks about the 3 different types of chiropractic care. And I like to go through this with people because I meet people literally on a daily basis who will say they've been to the chiropractor, and I ask them, "That's awesome, what kind of care did you do?" And nobody ever knows what I'm talking about. They say chiropractic care, and they don't really realize there's different types of care. Most people know about relief care or come when you hurt care. It's basically someone just going in whenever they feel like they're in pain. Corrective care is fixing the muscles and tissues and why somebody's in pain. And then preventative care is preventing problems. People who don't have any aches and pains are coming in to keep it that way. Now most people enter here, and this is most likely where you are at obvious symptoms. And as we work on you, you're going to move your way across this chart to where you want to be, which is called optimum function. As we work on you, and you move across, one of the first spots people tend to sometimes screw up is they get to this symptoms gone phase, and guess what they do? Right, they quit because they think they're all better. Now the problem is, if these muscle and tissue changes have not happened, what do you think is going to happen to that person when they stop and then they go do something that stresses that area again? Right, it's all going to come back. And then what happens is then they come back in and get worked on, and then they feel great again and disappear. And then it happens again and again and again and again and again, and every time it takes a little bit longer because it's a little bit worse. And that's really not the best option. What's better is to make sure you get these muscle and tissue changes to happen so that you're way up here in this optimum function zone. Now you're probably thinking, well, how are you going to know when those muscle and tissue changes have happened? And my question to you is, how do you know? Any idea? The answer is all of those tests we did with you on the first time. Those tests show us how you're working. What we have is we have all of your tests written down on our progress graph, and what we do is every 12 visits we redo all of your tests, and then we compare it to the first time, and we're actually going to be able to track your progress on this graph here. So you start at 0, and then this is the percentage that you improve on your physical testing, meaning how far you can bend and move and turn, how many muscle knots you have, all of those tests we did. And this way each month we can track you and know where you are. One of the problems is when people hit right about 40%, guess how they feel? Right, they feel great. So here's the problem. If you got here and you said, "I feel great, I'm done," and you left 60% of the tests you can't do, you leave them in your body, what do you think is going to happen? That problem's going to just come right back. And so from a testing standpoint, it's very easy to see that if we don't get all those tests handled, the problems are going to recur. And these are how we know when the muscle and tissue changes have happened. Now speaking of muscle and tissue change, in the beginning when we're working on you, we need to work on it frequently enough that muscles change. So have you ever been to the gym? How frequent do they tell you to come to the gym? Usually it's at least 3 times a week. So guess what we're doing? The same thing. 3 times a week is what it takes to change muscle and tissue. Once we get those muscle and tissue changes, then we can do a lot less to maintain it. Our test will tell us when that occurs. Now, one of the things sometimes people get panicky about is, oh my gosh, I can't afford 3 times a week. And you're right, very few people can. However, what we do is we're going to estimate next time what it's going to take. We're going to figure out how to fit that into your budget so you can do it and not be stressed out. One of the strategies that we have is we estimate how long you need 3 times a week, how long less than that to maintain that, and we figure that out over a 12-month period. And then we take your total cost for the year, divide it by the 12 months of the year, and all of a sudden it's fitting in people's budgets. So we have many strategies to do to try to work it so that you can get the care that you need and still fit it in your budget. So I explain that so you can just put you at ease. Next time we're going to go through that. Now, one of the things that you see with the muscles and tissues is that when a muscle or tissue is injured, what does it do? It spasms and contracts down. It's very similar to this. If you were to traumatize my muscle here, if something hit my muscle and hurt it, that muscle would contract. It would pull my arm up and I would hold my arm like this because it hurt. And if I kept it like that over the years, pretty soon I wouldn't be able to open my arm. If I left my arm like this, I wouldn't be able to use it. I would have poor function. If I met you and you said, "Hey, Dr. Mike, your arm doesn't work. Let's fix it. Could you just pull on my arm one time really hard and you'd have it fixed?" Yeah, no way. You'd pull on it, I probably wouldn't like it, and as soon as you let go of my arm, what would it do? It would pull back. Do it again. It pulls back. Do it again. It pulls back. Do it again. It pulls back. If we did that at least 3 times a week, we would actually get the muscle and tissue in there to change, and a handful of months later, we'd have this arm working so good you'd never know that it was traumatized and damaged. And that is what we're trying to do with your neck and your spine. Those little muscles in there, when they've been traumatized, they contract and pinch down and hold those vertebrae in the wrong position where you have pinching and irritation. We're changing that, restoring your function, measuring it with our tests so we can get you at your optimum. We're going to go through next time and figure out how to make that happen. Let's get you adjusted.